Hi, everyone. I'm Renee Wooding, and I'm the Managing Director of Cool Kids here in Maryland. And I want to thank everybody for joining us tonight. This is the second in our series of webinars for Cool Kids parents. And tonight's topic is about childhood cancer and bullying. And the reason that we chose this topic is that I read a medical journal article that stated that 25% of children treated for cancer report being bullied at school. And since that's a self-reported number from the children themselves, I suspect that's probably low. And we started hearing some incidents of it with our cool kids. And when I spoke to Dr. Carey, she said that unfortunately she's seeing more of it. So we feel like this is a really important topic to cover, and one that a lot of people don't know happens to this population. So we're going to learn tonight what constitutes bullying, how to recognize the signs in your child, and what you can do about it. So before I introduce Dr. Carey, I want to just cover a few housekeeping issues. And the first is that, as I mentioned, this is the second in our webinar series. The first one was chemo, brain, and learning. So we learned about how the effects of chemo and other cancer treatments might impact the executive function of the child's brain and make learning a little bit more challenging, and what we can do about that. And if you missed that and you're interested, you can find it in our YouTube playlist. This session will also be recorded and put in our YouTube playlist. So if you're watching this in the future from YouTube, we would love it if you would like and subscribe so we can continue to send you content. On March 9th, we will have another webinar, and the topic of that will be around nutrition. We'll be joined by a registered dietitian, and we'll learn how to read nutrition labels. So if it says 10 grams of protein, is that good? Is that not good? How do we understand? And what does organic mean? And is cage-free good, or does that really mean anything? So the object is to learn what's worth paying a little bit more money for and what things are really just marketing ploys that aren't worth spending your money on, because you may not be getting the nutrition you think you are. So that'll be on March 9th. You'll see more coming out about that. Lastly, we also have some other weekly wellness videos that we're going to be rolling out starting tomorrow night. And these are in conjunction with FX Well, and they're really going to be about your own well-being as a caregiver. So tomorrow's is about managing and reframing negative thinking. So we'll be doing lots of those going forward. So look for those as well. And tonight, we encourage you to ask questions. You can use the chat function in Zoom, and Taylor, who's with us, will be monitoring that so we can ask Dr. Carey questions as we go. So first, just to tell you a little bit about our guest tonight, Dr. Lisa Beth Carey is a teacher, educator, and researcher with a focus on improving educational experiences and outcomes with neurodevelopmental disabilities. For those students who have those disabilities. Dr. Carey was one of the inaugural fellows for the Center of Innovation and Leadership in Special Education, where she received extensive training in cognitive neuroscience and learning, behavioral science, school law, and research methods. And prior to that, she held a number of positions in special education, and she really focused on inclusive practices for students with emotional, behavioral, and developmental disabilities. So we are really thrilled to have her. Dr. Carey is currently with Kennedy Krieger Institute, and we're really grateful to have her expertise with us tonight. So I'm going to start off just asking some questions, and hopefully our listeners will also join in and ask some of their own. But could we just start off with maybe the most basic question: what is bullying, and what activities fall into that definition?
So there are a few different ways of looking at bullying, but I'm going to actually quote the Maryland law for that, since the majority of folks are coming to us from Maryland public schools. But the Maryland law is based on a more federal recognition of bullying and harassment and intimidation, which tend to be grouped together. So Maryland law defines bullying, harassment, intimidation as threats or serious intimidating that occurs on school property, at a school activity or event, or on a school bus, and substantially disrupts learning or the school day, and is also often indicate, like, they ask questions about, is it motivated by a potential bias? And one of the biases that's listed includes physical or mental ability or disability. In general, there are a few different types of bullying. So there's physical bullying. So it could involve being hit, kicked, punched, those kinds of things, or threats of harm. Verbal bullying, so name calling, insulting, teasing. Relational bullying often happens where kids exclude people, so shunning, kinds of the behaviors. Reactive bullying is when someone who had been bullied then goes off and bullies others. And then cyberbullying, which we're hearing more about, which is bullying that's happening online. So it could be a combination of that verbal bullying with threats of violence, or it could be shunning behaviors as well. So not including someone in conversations happening online and then talking about them or sharing information about them. And it could also involve sending threatening emails, texts, tweets, messages, all kinds of digital messaging are included. And even if there's cyberbullying going on, Maryland law recognizes that if it is disruptive to the learning of the student, the school day, anything related to school, that it's still the purview of the school. And so you should still be reporting that. So all of these different types of bullying can occur. And I think one of the big things to remember is that bullying is often not considered to be a one-time incident. So it's an ongoing behavior. So is it ongoing? Do you feel like it's not going to stop? Those kinds of questions usually come into play.
Thank you. And, I suspect kids aren't always really forthcoming with telling their parents that they're experiencing bullying. So are there some signs that parents should be looking for that might indicate that could be happening to their child?
So there are certainly lists of signs that parents and educators are given in terms of like looking for behavioral indicators that a child is being bullied, since, as you said, they don't always let us know. But I want to just say that there's a caveat with a lot of them, that there could be an alternative explanation. And I'll go through the list and I'll point out where the alternative explanation might be the late effects of cancer and treatment themselves, right? So first we have unexplained injuries. That's a little straightforward, right? If someone's coming home hurt, clothing ripped and stuff like that, and they won't explain or can't explain why, that's a red flag. So lost, destroyed clothing, books, electronics, or jewelry. So having items just kind of vanish. Now, the caveat with that is that kids with memory and executive function needs often misplace items, that they lose things, they can't recall where it was, they legitimately can't recall, they're not withholding information, they really don't know. So we want to be a little careful with that. I've had experiences in the past where students reported that they thought someone had taken something, and we actually had, most public school buildings actually have video cameras in the hallway. So we went back to the video camera and just figured out that the student themselves had misplaced the item, which was fine. And we were willing to investigate that, but it just turned out that in that case, this was a student who had significant memory and executive function needs, and he just was confused. Now, he was suspicious because there were kids that were being unkind to him also, which is another reason we were willing to look into it. But just know that there's sometimes alternate explanations. So then kids complaining of frequent headaches, stomach aches, feeling ill, faking illnesses is another thing that's often listed. But those things are all common for childhood cancer survivors. And so one thing I want to be clear at is that when we're looking at these patterns, just to remember that all teachers in the state of Maryland are getting training on bullying, and that they may misinterpret kids saying that they don't feel well repeatedly as making excuses to avoid situations, scenarios, or even types of work. And so we want to be clear with all of the school staff about what's going on, and that if a child is saying that they don't feel well, they have a headache, that we should believe them first. And then we should be mindful of when is this happening? Is it always the same class or the same time of day or the same subject? Or is it happening a lot during lunch? I've definitely have personal experience of kids doing a lot of different things to avoid going to lunch because that's where the bullying is occurring. So when we see kids kind of trying to avoid those unstructured times of the day, that's when we should really start to look out and be like, what's going on? Why are you trying to avoid that? Changes in eating habits, so skipping meals or binge eating, or coming home hungry because you didn't eat lunch, right? So coming home, if the kid has a lunchbox, the lunchbox is always still full because they're trying to avoid being in the cafeteria, but that could be a sign. Difficulty sleeping or frequent nightmares is also listed as a sign, but that also might be a sign of trauma from illness and treatment. So if your child is experiencing nightmares and having trouble with sleep, that's something to let your medical team know about. Declining grades, loss of interest in school, or not wanting to go to school could be a sign of bullying, but it could also be a sign that they're really struggling with school for other reasons. And so once again, talk to the school team and talk to your medical team and let people know. What we found in, at least at Kennedy Krieger in our oncology follow-up neuropsychology clinic, is that sometimes families don't realize they can go back to the medical team and tell them about schooling issues, right? So both the medical team and the school team need to communicate because there's alternative explanations that each group might not key into unless they're talking. Sudden loss of friends, avoidance of social situations, decreased self-esteem, and then finally self-destructive behaviors like running away, harming yourself, or talking about harming yourself, or suicide. And again, I just want to really emphasize that even with young children, any talk of self-harm really needs to be brought to the attention of medical professionals immediately, that we shouldn't assume that, sometimes families assume that young children won't actually follow through on threats of self-harm. And for safety reasons, you just always need to follow through on any kind of comments like that.
Yeah, that's great. I'm glad that you brought up the topic about teachers, because we have heard that, you know, and I think most teachers really do their best to really try to accommodate these kids. But once in a while, we hear about a teacher who doesn't believe that a child needs to see the nurse or is tired or isn't feeling well. And I wonder if a family sees that happening, like what's the best way to address that? Do you go directly to the teacher and, you know, have that conversation about your child's health, or what's the best way to handle it?
Right. So I always like to start with the assumption that that the issue has to do with not having a shared understanding of the situation. And I just want to let parents know that within teacher education, improving the knowledge base that we provide teachers who are in training, and even teachers who are in the classroom, that we don't provide them with enough information about children with chronic and complex health needs, right? So this is not isolated to childhood cancer survivors. This is kids with a whole range of medical needs, where there is plenty of literature showing that schools of ed aren't covering the topic, that teacher trainings aren't covering the topic, and that teachers report feeling unprepared. So there's first this missing gap. We have this gap of knowledge. And so just coming into it, we can kind of just predict that some education needs to happen for the school staff. So kind of sharing some resources with them, having conversations, and having this be ongoing as much as possible. And even if your child or teen is well beyond treatment at this point, it's still important to have these ongoing conversations, because it seems like the further you get out from treatment, the more confusion actually starts to occur. Like, oh, well, you're fine now, right? So, continuing to have those conversations. And if you feel like that isn't enough, then requesting a meeting with the teacher, including the school nurse, can be really helpful, so that you have other people in the building, maybe the school psychologist, just so that there's a group of a more interdisciplinary group of people. If the kid in question has an IEP, if they are receiving special education and related services, having a conversation with the IEP team would be really helpful. And if they have a 504 plan, meeting with whoever the case manager is for that, which is typically the guidance counselor in most schools. Sometimes it's the school social worker. So identifying who the support staff is in the building and then having a meeting with them. Again, not to say like you're doing everything wrong, but just being like, let's just assume that we need to have some shared understanding. And then also acknowledge that teachers are trained to identify when kids are trying to avoid work, right? So identifying these patterns of behavior, and there can be easily misunderstandings about what looks like escaping behaviors related to work avoidance versus late effects of cancer and treatment, right? So you want to make sure everyone's on the same page. If after doing that, things are still not improving, then you should speak to the school principal and make a complaint. And what I have found is that for those first intervention steps of just being like, let's all get on the same page here, usually works really well. Teachers are usually happy to be getting in more information about their students, and are eager to find out what they can be doing to make things better. Unfortunately, there are some teachers who continue to like have just negative relationships with the student. And so going to the principal is helpful. In my experience, the teachers who continue to struggle with that student-teacher relationship, even after getting all that information, that's not the only student that they're struggling to have that relationship with. And so letting the principal know can be really helpful in terms of having an intervention that is beneficial for not just your child, but other children in the building. Oh yeah, go ahead.
I was just going to say, I think you make a great point that the further you get out from being in treatment, the more of a struggle it can be to gain that understanding, because we do see that like once the child's hair's grown back, sometimes people think, well, everything's back to normal, so your academic performance should be back to normal too. So I would just encourage that if that's an issue that anyone watching this is having, refer back to our last video that we did with Erica Carson from the Brain Bodega, which was about chemo and the brain, and that can help to, help you and perhaps the teacher understand a little bit more about the lasting effects of chemo and other treatments. But
yeah, definitely any resources that you can share to help the school know that it's an ongoing component.
Great. So let's say that the bullying is happening from another student. What's the optimal way to address that doesn't sort of escalate the situation or make the child feel afraid that it might escalate the situation?
So talking to the kid about it, and I'm saying kid because it could be a child or a teen, there's this whole range of ages, but speaking to them, particularly if they're older, so that you have their opinion of what needs to be done. Sometimes children and teens are fearful of retaliation, and want to make sure that things are handled in a way that isn't going to make the situation feel worse for them, and that we should listen to some of those concerns because they're the ones that have to show up in school. And if the interventions that we put in place don't make them feel better, then we haven't really achieved anything. So Maryland schools are required to have bullying, harassment, and intimidation forms available to all students and families. And that form is slightly different in each school system, but you can look it up, or there's usually also a physical form available in the front office. And a student can fill it out, a parent can fill it out, another caregiver, even a teacher, right? So I have sat down with students and helped them fill out that form before. And once that form is filled out, the school needs to respond and share this response with the family within a certain time frame. And the response doesn't need to be negative consequences. In fact, like having really negative consequences has not been shown to really improve things so much. So the intervention is usually to have some kind of conflict resolution go on with the students involved. So it could be a group conversation with the school's social worker or psychologist or guidance counselor, perhaps even the principal themselves, depends on the structure of the school building. Sometimes there are peer mediators within the building that can kind of work on the situation. And then some schools actually have social justice, so restorative practices kind of setups, and I can actually provide some more information about that at the end. But restorative practices and restorative justice have to do with creating a kind of literal circle, you sit in a circle, and having different people who are identified as part of the community. So it could be the students involved, their parents, fellow students, teachers, anyone who's an important member of this circle. And you discuss what the harm was. So what happened that harmed someone, what happened, what made them, how do they feel about that? And then the person who caused the harm is given space to speak and explain and reflect. And every member of the circle is also invited to share what happened, how that impacted them. And as a group, they make a plan to repair the harm. So it's not necessarily about punishment, it's about repairing the relationships and leaving the circles with a path forward so that people start to feel better. So the Maryland School of Law actually has some great resources about restorative justice practices. And as I said, many schools in Maryland have started using this. So if your school is using it, you can request to have a restorative justice circle implemented on your child or teen's behalf. Or you can, if they don't have it in the school, you can ask that the school look into it, that it might be a valuable practice to start engaging in.
That's interesting. And I just want to remind those participating on the call, if you have questions, we encourage you to submit them using the chat function, or if you're just on the phone and not on the actual video Zoom, you can just unmute your line at any time and ask a question. So I'll just give a few seconds here in case anyone wants to chime in with a question.
I have a question. What if your child has acknowledged that they're being bullied, but absolutely doesn't want the parent to go forward to, the teacher or whoever, because they're afraid of that it's going to make it worse? How do you suggest that that's handled?
So I think kind of breaking down with the child about what makes them think it would be worse and what are actions that they would be willing to have happen or for them to take. So just kind of saying like, what outcomes are unacceptable to you? And then what are steps that might be acceptable to you, and giving options, because younger kids have trouble coming up with plans sometimes. And then asking if it would be okay with them, if there are any trusted adults in the building that they would feel comfortable talking to, or they would feel comfortable with you talking to, or both of you at the same time. Not with the goal of being to punish the other students or even to do anything, but just to say, who is a trusted adult in the building that you feel comfortable sharing this information with, so that someone is aware that it's going on, and to also get their perspective. Sometimes when we're outside of the school building, as parents, as caregivers, as family members, we don't see the dynamic going on. And so it's hard for us to come up with potential solutions that the child or teen feels comfortable with. So finding that trusted adult in the building who knows the landscape a little bit better than us can help guide that problem-solving process and help come up with solutions that the child or teen might feel more comfortable with.
Okay, thank you.
Great. I think sometimes too, what we see, I'm not really sure that it necessarily falls into the strict definition of bullying. For instance, the comments like, what's up with your hair, or, some inelegantly asked question about a scar from a port that kind of leaves a child feeling self-conscious about it. I'm not sure that those things were entered into in the spirit of bullying, but they're still impactful to the child who receives the comments, and they're hurtful and sometimes long lasting. So how do you classify that kind of behavior, and what's the best way to address that?
Mm-hmm. So sometimes those comments come from a genuine interest, that kids just want to know what's going on, and that they don't have haven't built up the social skills yet to ask in a way that wouldn't be upsetting. And so one thing to do is just kind of find ways to educate the peer group but also just recognizing that you can't do that kind of education with everyone that your kid might come in contact with. So one thing that can be helpful is to help your kid or your teen come up with rehearsed responses to comments that might be hurtful, because it's hard to think in the moment of what to say. And those responses shouldn't be like comebacks or clapbacks, I think is what the young people are calling them today. But it should be neutral but self-affirming. So, you know, if someone makes a comment about your hair, you're like, oh, well, that's because I'm a survivor. You know, something just kind of being like, you know, not assuming that the other person is being mean to you, but just saying like having a response that, again, is a response so that you don't feel like you just got stuck in the moment and then feel bad about yourself for not responding, and then also is self-affirming but doesn't cause any kind of escalation in a conflict. I think that also just, again, identifying those trusted adults in the school building, at camp, wherever your kid may be, having those trusted adults to go to, not to tattletale or necessarily, because some kids are like, I'm not going to tell on people, but just to be like, this happened, can you help me work through what I should do, or this is how I'm feeling because that happened. And like I said, this happens all the time because kids are genuinely interested, and every teacher can tell you that they've had their own share of comments launched at them by curious kids that were like, oh, that hurt, but I know you didn't mean to be insulting, right? So we know that this happens a lot in school, and just helping kids to rehearse being self-assured and feeling like they have a response can be really helpful. And I think also just getting the word out as much as possible about the different kinds of social issues faced by childhood cancer survivors can be really helpful. Like just more generally speaking, like this should be conversations that we have about childhood cancer survivorship. You know, we talk a lot about treatment, obviously, we have good reason to be talking about treatment, but just kind of talking about like the lifestyle stuff that goes on, right? So for example, I know that the Leukemia and Lymphoma Society right now are engaged in their really active school fundraising campaigns, right? They've identified their what do they call them? Their ambassadors for like, so they have teenagers and kids that are ambassadors right now. So there are these peer leaders out there talking about blood cancers that are very common to kids, and they're raising money and they're talking about cures, but those peer leaders could also be talking about bullying, right? So they could be in their messaging talking about like, by the way, you know, kids with cancer go to school with us. What are we doing to make sure that they have a good experience? So just kind of like finding ways to get that message in as much as possible. And then also, I think along with that messaging, recognizing that other kids with chronic and complex medical conditions face the same thing. And so kind of like aligning forces. So sometimes we get really caught up in our little like networks because it's really helpful to have people with very shared experiences with us support us, but sometimes we need to branch out a little bit better to have that kind of impact that we need to have.
Right. And I guess it's tricky too, because some children probably, or some families may want to keep the diagnosis more private than others. But if someone is comfortable with other children in the classroom knowing, I wonder if any of the teachers ever do any sort of lesson plan around cancer and cancer treatment that just helps children understand what it is. I remember way before the pandemic talking to one nonprofit that said, you know, they learned that the children in the child's class thought they were washing their hands to protect themselves so they didn't catch cancer. They didn't realize they were trying to protect the child with cancer. And it seems like that kind of lesson planning would be helpful. Does that happen?
I know that there are some groups, and I can't off the top of my head remember exactly which ones have some lesson plans about that. And it does focus on the like, you can't catch cancer, you're not like, you know, that kind of stuff. Although we also don't want to message to kids that we need to, you know, shun people with communicable diseases. So, you know, kind of being careful with that messaging. But just kind of helping students understand there are I know that Brain Pop, which is this great multimedia support, like educational support program, has videos about all these different topics, and cancer is one of them. So they have like, that's a really helpful tool because teachers use Brain Pop all the time to go over lots of different concepts. And that's just, this is part of our normal repertoire. And now we're going to watch a video about this, right? So having those kinds of materials available can be helpful. Also just like, checking with your medical providers, if they know of anyone or if they're willing to come and chat with other kids about what's going on, or even do like, a Zoom meeting with the class and just talk to the kids and about what's going on. For older kids, like you may want to bring in people who are healthcare providers, because it's another opportunity to see careers, right? So you can like join it in with, we're doing career exploration in biology, but also let's talk to a cancer researcher or an oncologist or an oncology nurse, right? So all these different people that are involved in providing care to cancer survivors, who can we bring in, but then also talk about career opportunities.
Yeah, that's a great idea. And I know there's a nonprofit out of, I believe, Michigan called Cancer ED or Cancer Ed that does lesson plans for grades 1 through 5. So I think things are out there if we have teachers that view this and want to look for resources. We'd be happy to help navigate that too. What other resources, are there other resources we haven't talked about that you would recommend that parents use if this is a topic of concern for them?
Sure. I think also knowing that there is the Safe Schools Maryland tip line, and that other states also, if there are people from other states here, I know I've talked about Maryland a lot, but that if you are afraid of retaliation, that you feel like you can't report things to the school, that there is this Safe Schools tip line where someone will then come to the school and check out what's been going on. So that's something to look at also. There's also stopbullying.gov, which is a federal government sponsored website that has tons of information about bullying prevention, and then what to do after bullying has occurred. So different kinds of responses. As I mentioned, the University of Maryland, Carey School of Law, not affiliated with me. We have the same, my last name is Carey, not affiliated, but University of Maryland, Carey School of Law has resources about restorative practices and restorative justice that are phenomenal. And they frequently do school trainings. So they're a resource if you want to get the staff at your school trained, you can kind of work with the school to contact them. And then I am part of an interdisciplinary lab at Kennedy Krieger, and then the Johns Hopkins School of Medicine, Johns Hopkins School of Nursing, and Johns Hopkins School of Education called the Success Lab. And our focus is issues related to schooling and cancer. And so we have created a webpage that is just filled with resources on that very specific topic. So there are roadmaps about the educational journey for kids with cancer. And then we also have blog posts. So I run a blog for teachers called Linking Research to Classrooms. And so we've covered this topic a bunch of times. And the blog posts are meant to be quick and filled with useful researched information. So we have a bunch of blog posts for teachers about like, what are late effects of cancer? What kinds of needs are really common among cancer survivors? What is a list of resources that are available? An interview with a neuropsychologist about the different, you talked about chemo brain earlier, like what is that? What are these needs? And then also like, okay, this child's no longer in treatment. Does that mean they're okay now? So those kinds of pieces of information are available too, along with white papers that could be shared with the school. We did a white paper about advocating during COVID and online learning scenarios for students. So there's tons of stuff on there. And if there are additional needs or wants from this community, we are happy to spend some time creating materials.
And we will distribute the link to that site, in our next family newsletter, as well as when this goes onto YouTube, we can put it in the description box below so everybody can easily find those resources as well.
Great.
So before we go any further, we just have a little bit of wrap up, but I do want to open up the lines one more time in case anybody has additional questions that they'd like to ask. Just feel free to unmute and ask, or send your message in the chat.
Yeah, I just wanted to add on that we're seeing parent bullying too. I know it's more culturally related, but parent being bullied, and then that whole feeling of the parent being bullied, that nervousness being transferred to the child. So just kind of a heads up, and I guess let you comment on that.
And the parent bullying is in regard to like blaming them that the child has cancer, perhaps, or shaming them, or
blaming,
okay.
shaming, shunning. Yeah.
Mm-hmm. So first of all, I'm really sad that that's happening, that we expect more out of adults. I would first say that I would recommend that parent seek out some kind of therapeutic supports for themselves, because there's no quick fix to that situation. And so making sure that their mental health is well supported while that's going on is really important. And then also letting the medical team and the school team know that that's happening. I'm assuming that in the scenario you described, that the parents that are doing the bullying of this parent are also part of their local community and most likely the school community. So kind of letting people know that that's going on. Also, restorative practices are not isolated to schools. These are practices that are frequently used within communities. And it actually seems like this is a situation in which that would be a valuable practice to try and use to open more beneficial lines of communication and try and heal those relationships that are being disrupted. And then I think just like doing some, if possible, doing some education within the school community, just so that people have a little bit more information about what's happening and why. And just kind of hoping that, like, with the hope that once people know better, they do better. But when it's adults, it's a little bit tricky because the school is not responsible for parent behavior unless it's disrupting the school day or causing harm or threatening students. But there might be resources that the school social worker, guidance counselor, or school psychologist might be able to refer the parent to, and as well as the medical team. And again, I would really strongly encourage the parent to seek support for themselves for their own mental health.
Thank you.
Other questions? Well, I guess the other thing that I would add as a shameless self-promotion is we do offer parent support groups at Cool Kids in conjunction with Sinai Hospital. So we would welcome parents who are dealing with this issue to join that, because you'll be with other parents of children with cancer who may have strategies that have worked for them. And we would love it if your children would join us for the activities that we do here at the clubhouse. Right now, we're not doing as much in person because of the rise in COVID numbers, but we're doing online programming, and we'll be having another camp in May and a retreat day for the moms and lots of other things. And it can just be really healthy for the kids to be around others who don't question what they're going through, because they've been through the same thing. So they don't need to explain anything. They can just be themselves, and everybody gets it. And if you need a break because you're tired, or you need a little additional fluid or whatever it is, nobody's judging or criticizing. So it can just be a really restorative environment, and we would welcome you. We also offer free tutoring. So if the bullying experience is impacting academic performance, that's a way that we can help with the academic portion of things. So lots of things there that we'd love to be able to offer that we hope will help. But I just really want to thank Dr. Carey for bringing her expertise to us tonight. We're so fortunate to be able to learn from you, and we really appreciate you taking time out of your personal time to do this. And I hope that it will be helpful to many other families going forward, and also would invite our families, if there are other topics that you would like to see us cover in future webinars, please submit them to Taylor or myself, because we're always happy to try to accommodate whatever you need. So thank you for that. And thanks everybody for being on the line tonight. Any final comments that you want to make, Dr. Carey, or are we good?
I feel like I talked a lot, so I'm sure people are tired of listening to my voice, but thank you so much for all that you do for this community. And I hope everyone takes care and has a great night.
Great. Thank you so much.